Fast spread of the Zika virus has women across the globe worried.
That is because it's been linked to birth defects in the countries where this virus is widespread. Our Robert Kittle was at the South Carolina Department of Health and Environmental Control today to check on possible cases here and what you need to know about this virus.
South Carolina has had 3 cases so far where the State Department of Health and Environmental Control has sent blood samples to the CDC for testing for the Zika virus. 1 was not Zika and 2 are pending.
So at this time we don't have any Zika virus cases here in South Carolina, so the threat is very, very low for any transmission of Zika virus here in South Carolina.
The people whose samples are being tested had traveled to one of the countries where the virus is widespread. The CDC says that's 24 countries right now, mostly in Central and South America, but also in Mexico and the Caribbean. The CDC is warning women of childbearing age to consider not traveling to those countries. It's not confirmed yet, but there seems to be a link between the Zika virus and babies born with abnormally small heads and brains.
If she's considering travel to one of the areas of the countries that are where there is widespread transmission, she should talk to her healthcare provider and be educated on Zika virus disease and have that discussion with your doctor.
Other than the possible link to birth defects, the disease itself is pretty mild. 80% of people have no symptoms, and if you do have symptoms, they include fever, rash, joint pain, and red eyes.
But there is no treatment or vaccine, and the diagnostic test is imperfect. The Zika virus is transmitted only by a certain kind of mosquito, so the CDC is recommending protection against mosquitoes, including wearing insect repellent and long pants and long sleeves. In Columbia, Robert Kittle, 7 News.
The World Health Organization says the Zika virus is spreading explosively in the Americas, and we could see up to 4 million cases over the next year.